Welcome to our presentation on alcohol consumption in Canada. For our year, highlighted that there are many things the average Canadian does not know about alcohol. The risks involved with consuming alcohol, the impact it has on those around you, and the increased risks seen with certain patterns surrounding alcohol consumption. Overall, with regards to public health, a new conversation with Canadians needs to happen at all levels of the healthcare system to inform Canadians about these risks and to encourage preventive medicine to prevent negative outcomes occurring before they happen.
In 1974, Canada's Federal Health Minister Marc Lalonde released a report that challenged the medical model of health that focused only on biological processes. He introduced the concept of social determinants of health and promoted the idea that health was based on four determinants: human biology, environment, lifestyle, and healthcare organization. He recommended that all levels of government should be active in health promotion as well as improving social, environment, political, and economic conditions. The Lalonde report targets alcohol consumption in Canada by identifying certain populations who are at risk for excessive alcohol consumption so that resources can be appropriately allocated. Alcohol consumption among the youth can result from peer pressure and dictate negative outcomes later in life. Therefore, health education is necessary to promote healthy habits. And lastly, the Lalonde report challenges the federal government to stimulate economic growth and reduce income inequality as a way to reduce unhealthy habits related to the social determinants of health.
Hi, my name is Will. I'm doing the Alma Alta Declaration, and this declaration was created to end health inequalities through the adoption of primary health care. This style of healthcare adopts a holistic approach which advocates for preventive medicine by correcting social, political, and economical causes of health-related issues, and it also states that governments, not individuals, should be the ones responsible for eliminating these inequalities. In regards to alcohol, the inequalities of our high-risk population are unacceptable, and governments and communities should be working towards eliminating whichever social, political, or economical cause is putting these populations at high risk. To the general public, the education on the risks are lacking for alcohol consumption and also should be corrected. And again, the burden of providing this information is the government's, not the individual's responsibility.
Hello, this is Anne speaking. I will be discussing the EP report. Highlights of the EP report include that health is influenced by many factors making health promotion necessary. Through health promotion, people can learn preventative health measures to reduce risky behaviors. Finally, there is a need to improve coping mechanisms for people with chronic diseases, mental health issues, and disabilities. The study by Marlett and Wikowitz showed that both the EP report and the public health report come to similar conclusions. Their study on youth and young adults' alcohol consumption showed that promoting harm reduction through education, skills, and activities reduced the likelihood of risky drinking behaviors as compared to youth and young adults not provided this information. It showed that health is strongly affected by beliefs and social environment. Therefore, health promotion and an open discussion on the risks of excessive alcohol consumption are necessary and effective ways to improve the health of Canadians.
Hi, my name is Will Whitmer. I'm doing the Ottawa Charter for Health Promotion. This charter highlights the 5 needs for global health promotion. The first is building healthy public policies, which in regard to alcohol in Canada already takes place, such as limits on who can buy alcohol at what age and what activities you can do while under the influence of alcohol. The second need is developing personal skills, which again are lacking in Canada, as not enough people know how to minimize risky behaviors, such as putting yourself in a position to be drinking and driving. And the final 3 are creating supportive environments, strengthening community actions, and reorientating health services. In regards to our high-risk population, Usually one of these three have failed and have resulted in them having unhealthy drinking activities.
Hello, my name is Deborah, and I will be discussing the Jakarta Declaration. It focuses on the priorities for health promotion in the 21st century and introduces the existence of diversity prerequisites that are necessary for achieving optimal health outcomes. These include peace, shelter, education, social security and relations, income, nutrition, sustainable resources and ecosystems, social justice, respect for human rights, including equality and the empowerment of women. It states that 5 strategies listed in the Ottawa Charter are imperative for success. It expresses the comprehensive approach is the most effective. In other words, government, non-government, private, and public sectors working together. As well as it states that a health promotion alliance must be created in order to increase the speed of global health priorities. The Declaration targets alcohol consumption in Canada through raising awareness in the changing terms of health, such as social and family situations, enables shared learning of alcohol consumption impacts and risks, provides public health accountability, supports, and resources, in the health promotion through discussion, collaboration, and the development of health networks.
Hello, my name is Pamela Macklin, and I'll be doing the Bangkok Charter. The World Health Organization states that the Bangkok Charter is an international agreement aimed at promoting health, creating sustainable policies, developing health practices, regulating higher-level health, and working to make a partnership to achieve better health globally. Commissioner report outlines alcohol consumption as problematic in Canada. Bangkok Charter can help in these ways. Promotion of health aims to display and address the detrimental effects of products and services, which would be important especially in the Aboriginal population. Developing health practices to prevent the most vulnerable groups from consuming alcohol. And working with partnerships to educate consumers of the long and short-term impacts of alcohol consumption. The Bangkok Charter, together with the Ottawa Charter, health promotions actions have been developed and evolved to support health promotions around the world.
This is Brooke, Canadian Health Act. The Canadian Health Act is a federal legislation passed in 1984. Each province and territory must have their own conditions as to who will have access to funding for healthcare services. Any treatment in a hospital setting not insured by the medical care plan are also uninsured in the hospital insurance plan. Alcohol treatment outside of Canada is one of these services. Thus, those with alcohol dependency cannot access treatment. The hospital insurance plan does not cover the committal to an alcohol dependence rehabilitation facility. In Saskatchewan, the Ministry of Health will cover out-of-province medical care received by Canadian residents through arranged billing. Alcohol rehabilitation needs prior approval from the ministry and specialists. In Nunavut, alcohol rehabilitation is not covered in a hospital setting without prior approval. This is important to know because in 2011, alcohol was the #1 psychoactive drug casual factor for hospitalization.
In conclusion, health promotion and education are necessary to improve the health of Canadians. There are still many inequalities in health among Canadians, and a stronger focus on health promotion for Aboriginal women and youth is needed. Social determinants of health are important factors to consider when discussing health issues such as alcohol consumption. These are references that we use throughout. Thank you for watching our presentation.